So there's some really simple diet techniques, healthy diet techniques that I think people really discount because we've heard them so many times, but they're really important and super simple. So use a smaller plate. We're not great at portion sizes. The whole your eyes are bigger than your plate kind of thing. So use a smaller plate so you don't have to worry about that. And then try to make half that plate some sort of fresh fruit or vegetable. That will naturally reduce the quantity of maybe the less optimal things on your plate. So just try to load up on healthy greens on one side, and then the other side, maybe you get a little bit more treats.
So I always talk about focusing on the healthy plate, and so especially for lunch and dinner, this works really well. So make half of your plate non-starchy vegetables, a quarter protein, and a quarter starch or carbohydrate, and focusing on whole grains or starchy vegetables for the carbohydrate. So that's always the first place that I like to start when meal planning, is making sure I have those three components, especially at lunch and dinner. And then I talk about increasing the color in our diet. So you want to make sure you have plenty of colorful fruits and vegetables and a lot of variety from day to day. You're not going to eat every color of fruit and vegetable every day, but you want to try most days and over a week's time to get all of those colors in.
If meal planning feels like a barrier to you because it does take a lot of time up front, really focus on the fact that it will save you so much time throughout the week. So maybe 3 or 4 hours in the weekend prepping food saves you an hour every night for the rest of the week. So really think about the time saving throughout the week when you're trying to prioritize meal planning. It's really an investment in your time, but it really pays off.
It's really important to include protein in your snack and healthy fat. And so it really helps to fill us up and make us feel satisfied by having protein and fat in a snack. And so some examples would be fruit with cheese, or fruit with nuts, or nut butter, sunflower butter. So you're getting that protein in. A hard-boiled egg with a piece of whole grain toast is another example. So I always emphasize protein when planning snacks.
Kids love snacks. I have a 6-year-old, all she eats is snacks. It's very difficult to get kids to eat healthy snacks. So especially during the summer when fresh fruits taste great, having those easily available, prepped and ready. Things like low-fat string cheese is really simple for a child. It doesn't require any prep for the parent. Pre-packaged, pre-prepped things can be very helpful. They also come at a cost, so cutting up your own apples in the morning can help cut down on the prep time, and it's a cost-effective way.
When you're planning snacks, don't be afraid to utilize pre-packaged items. Think of cheese sticks. They have pre-packaged hummus cups. There are pre-packaged fruit cups. Those are all great to utilize for healthy snacks. We just want to make sure that we're balancing protein, carbohydrate, and a little bit of fat so that those snacks are filling and fueling your kids throughout the day. So we recommend whole grain crackers with hummus or nut butter. Fruit and cheese is always an excellent pairing. Nuts and dried fruit. And there are even just single serving options. Crispy chickpeas, edamame, all carry an even dose of protein, carbohydrate, and fat, so you don't even have to pair it with anything.
It is important to seek maybe some professional assistance in weight loss when you feel like you are ready, willing, and able. If you feel like this isn't going to add to your stress and that you have the ability to make changes. If it's really stressing you out and you feel like there are very limited changes you can make in your diet, that might not be the best time. So find a time when you know you can make changes, that it's not going to disrupt your life. And then getting advice from a professional instead of going with the latest trend is always advisable.
Also, I always recommend journaling. If you're having a hard time losing weight or you feel stuck, keeping a diet journal can be really helpful of what you ate, when you ate it, maybe how you're feeling when you ate that food. It can be a good personal tool for self-reflection, but also if you come to see a dietitian or a practitioner, they may also, that's a very useful tool for us when we see patients or clients, is being able to review your diet journal or your intake for 2 to 3 days.
If you have been seeing weight loss prior and now you're not losing any weight, that's what we would call a plateau, and that's a totally normal part of weight loss. This can last for up to a month. So if you've been stuck at the same weight, you've been consistent with your activity and your nutrition, then that is totally fine. Just continue to be consistent. Your body is simply adjusting metabolically to those changes. So that is normal. But if this prolongs over a month or over 2 months, that would be when we would start to consider going to see your doctor. There are other things besides nutrition and fitness that can impact your weight. So if there are certain medications, you may have a hormonal imbalance. So if it's been over a month, up to 2 months, and you have made significant changes and you're not seeing any difference, that's when you're gonna wanna go see your primary care provider, get some lab work done, make sure that your medications aren't holding you back.